Hello, my name is Isaac Navarro, and welcome to People in Perspective. Joining me on this edition is Dr. Doug Evans, an orthopedic surgeon at Loyola Hospital. Welcome to the show, Doug.
Thank you, Isaac.
How did you get into healthcare?
Well, I started actually when I was in school, about your age, and participating in sports, and had some injuries of my own. And like so many times, I met somebody that I thought was pretty neat, my orthopedic surgeon, Dr. Don Douglas, and through him treating me for my injuries, I kind of thought what he did was interesting, and it kind of started my interest in medicine and followed on from there.
Did you have any injuries of your own when you were a kid?
Yeah, unfortunately, I played a lot of hockey growing up, so I definitely had my own injuries, and I separated both shoulders. I've broken some fingers and toes. Actually, when I was 2 years old, I even broke my femur, which is the biggest bone in your body, your thigh bone.
What are common injuries that you see?
So as a sports medicine physician, I see injuries all over the body. I see a lot of joint injuries, especially knees and shoulders. I see some hips and ankles. Occasionally we see some fractures and even some spine and head injuries.
What are some of the worst injuries that you see?
Well, obviously we worry about anything, any injury to the spine or head. Those can be very severe and debilitating injuries. And we see those on the field when I'm covering sports, but I have partners who take care of the spine and head for the most part. The injuries that I actually take care of are pretty severe. I frequently see high-level trauma from motorcycle accidents, car accidents, things like that. So I'll see a lot of broken bones and sometimes some pretty severe knee injuries.
How are bone injuries different from other injuries that you see?
Well, bones can be fractured, obviously, and when they're fractured, they can be difficult to put back together. So once we get them aligned and put back together, we have to treat them oftentimes with surgery, with plates and screws, sometimes with rods that we put down the center of the bone. Joints are a little different. They tend to be more soft tissue injuries, more ligaments, tendons, cartilages, things like that. So tend to treat them a little differently.
What's a normal work day at the hospital?
Well, it depends on what I'm doing that day. As a surgeon, I have some days that I'm in surgery and some days that I'm in the clinic. Some days I'm seeing patients in the clinic, kind of like you might go to see your doctor and have a visit with him or her. And other days I'm performing surgeries and spend the day in the operating room.
So what do you do in the clinic?
So patients come in with different injuries and issues that they need to talk about and need treatment for. So we interview the patient, take a look at them from a physical standpoint, do a physical exam. Frequently we'll have x-rays, or sometimes we'll order more advanced imaging like MRIs and things like that. And then use that information to formulate a diagnosis and ultimately a treatment plan for that injury.
What are some challenges you face with surgeries?
Surgeries can be challenging in many ways, from just simply completing the surgery. Sometimes we have difficult procedures that just difficult to make sure that you get right and keep the patient safe while you're doing them. And then there can be other challenges. Sometimes with surgery you can have complications like infections or problems healing, problems with the wounds. So unfortunately surgery can definitely present its own set of complications.
How do you prevent common injuries?
In sports, people get hurt, unfortunately, and you can't prevent all of those injuries. But in general, we like to make sure that our athletes are as healthy as they can be. Their nutrition and hydration is important. Obviously, having the appropriately fitting protective equipment for contact sports is all important. And then, of course, we got to worry about environmental issues too. So sometimes we have to worry about frostbite or heat stroke or other weather-related issues too.
How do you recover from a surgery?
Well, obviously it depends on the surgery. If you have an injury or a surgery on your knee, it's a little different than an injury on your shoulder. Some surgeries we have to keep them off of it for a little while. If they break a bone, obviously we try and keep them off the bone for a little while so that the bone has a chance to heal. Some cases we can let them weight bear on it, sometimes not. Sometimes it's just a matter of time. You just need the bone to heal, or the ligament that we repaired to heal back where it belongs.
Well, thank you, Dr. Evans, for coming out and for this edition of People in Perspective.
Great.
It's Isaac Navarro. Bye.